Friends, hello. Today we are going to be discussing something about vaginal laxity. That means commonly we try to abbreviate this as a loose vagina. Now it is important for us to understand that actually if we study the microanatomy of the vagina is as such a collapsed system. It is not a closed system. The vagina is a collapsed organ, right? That means the anterior wall and the posterior wall of the vagina, if I study them, these walls are actually approximating each other in a normal resting state of the body. Correct? Whenever we try to speak of a loose vagina, or whenever we try to speak saying that I am experiencing vaginal laxity, right? We are basically trying to look at 3 points. One is laxity in the inside of the vagina, laxity at the depth of the vagina, and laxity at the vaginal introitus, that is the opening of the vagina. Okay. Remember one thing, out of all the multiple causes which we need to know and evaluate, the first history which we always ask our patients as far as vaginal laxity is concerned, that is always and always going to be about previous childbirth. Okay, now this is a very important history which we want to ask. Childbirth as such, especially if you have had a vaginal delivery, the childbirth process itself is such that it will cause laxity here at the middle of the vagina due to distension, and at the outlet of the vagina predominantly because vaginal deliveries, majority of the places in India at least, you will be given something called as an episiotomy. So that is going to give rise to a vaginal laxity. Does it really mean that all women who have a normal vaginal delivery experience vaginal laxity? So the answer to that question is a plain and simple no. We really don't know why some women experience laxity. Okay, that is one. Now, second, vaginal laxity is very, very subjective. That means it also depends upon the shaft size of the penis of your partner. So, if I were to just draw this entire anatomy for you slightly differently, and when I erase this entire thing, and when I just draw the whole thing in a different manner for everyone, you will realize that what I'm trying to draw and what I'm trying to correlate is going to depend on partner to partner variations as well. That means you can have a partner whose penis size is large and he may not experience any vaginal laxity, and you can have a partner whose penis size is small and he may experience a severe vaginal laxity. So if I just draw the vagina in a cross plane, that means if I just draw the vagina in a separate plane altogether, okay, and if I draw the penis in blue color, that means when the penis is going inside, okay, erect penis. If the shaft size of the penis and the shaft size of the vagina is grossly disproportionate, then they will experience something called as vaginal laxity, right? Simultaneously, I mentioned about the introitus. If you have a very loose introitus, okay, there will be experience of a loose vagina at the act of intercourse, okay. Now remember, majority of the couples don't experience this predominantly because of an excellent lubrication. Whenever the lubrication is very good, lubrication itself makes the entire coating so soft that people don't understand vaginal laxity so much. Often, when we try to see of an Indian scenario, we realize that couples usually don't complain so much about vaginal laxity. That is because they sort of learn to live with it. Okay. That is not a very good thing. Remember, vaginal laxity predominantly requires evaluation. Very few women who actually have vaginal laxity require a form of surgical management. You need to keep a note of this. People often think that, okay, whenever I have vaginal laxity and if I go to a doctor, I will have to get operated. It's actually the exact reverse. It's exactly the reverse, right? There are so many non-surgical methods which are available in order to make sure that a subtle correction in vaginal laxity can be achieved, and this correction will help you enjoy your sexual life in a much better manner should you be experiencing this complaint. Any more questions to this, you can post down in our comments box. Somebody from my team should be in a position to get back.